Thank you very much. Dr. Tufton, over to you.
Thank you very much, Madam Speaker. Madam Speaker, 2020 has been an extraordinary year for Jamaica and indeed the world. The COVID-19 virus and its impact globally and on Jamaica has been life-changing. This, Madam Speaker, has been a once-in-a-100-year experience. There was no playbook prescribing a response. We had to adjust and learn as we went along. This public health threat tested our strength as a people, our leadership as a government, our resilience, courage, and public health expertise and infrastructure. We all witnessed, in disbelief at times, shutdowns and restrictions on communities, workplaces, schools, critical gatherings such as worshiping at our church, celebrations for weddings and birthdays, and even mourning our loved ones at their funerals. Madam Speaker, life changed dramatically for us on Tuesday, March 10th, 2020, when the first case of the coronavirus was announced here in Jamaica at approximately 12:15 in the afternoon. 13 months on, and the statistics continue to mount. Over 800 deaths and close to 50,000 infections up to May 15, 2021. Madam Speaker, please permit me to place on record my sincere condolences to the victims of the COVID-19 virus and their family members and friends. I am sure that the country and this House mourns with them, and our prayers continue to be for their strength and their guidance. May their souls rest in peace. Permit me also, Madam Speaker, to ask this Honourable House to thank and applaud the approximately 37,000 healthcare workers in the public and private sector and our local, bilateral and multilateral partners for the hard work and sacrifice that they have made to protect all of us from this not-so-novel coronavirus. In appreciation and gratitude for the unwavering dedication to the fight against the COVID-19 pandemic by healthcare workers, 2021 has been designated the International Year of Health and Care Workers by the World Health Organization. Here in Jamaica, Madam Speaker, I am sure we all agree, we embrace and celebrate our healthcare heroes. And just a symbol of their representation, Madam Speaker, we have with us in the gallery Nurse Marcia Thomas Yetman and Dr. Sandra Hill Cameron, both who have served over 20 years in public health and who have been on the front line of the COVID pandemic response. We celebrate them and all that they represent. Allow me also, Madam Speaker, to say a big thank you to the Jamaican people. In the midst of fear and uncertainty, they remained steadfast in their support of the government's efforts, which resulted in the spread of the virus being less than initially predicted. Madam Speaker, no health system or infrastructure anywhere in the world could have prepared for this public health catastrophe. We have seen many more advanced and more well-resourced countries buckle under the pressures of demand for doctors and nurses, hospital beds, oxygen, and even morgues to house their dead. Here in Jamaica, we struggled at times, but we were never so overwhelmed that we were unable to respond. This government worked with the people for the protection of the people, and the people responded on September 3rd, 2021 with a mandate mandate under the leadership of Andrew Holness to continue our stewardship, to chart us through these challenging times. I want to pause here, Madam Speaker, colleagues, to therefore express my thanks and gratitude to the Most Honourable Prime Minister, Andrew Holness, for his reappointing me to this position as Portfolio Minister. A difficult task, but a unique opportunity to continue after 4 years in this position. I say thanks to him for his confidence. I also want to say thanks to him for assigning me my State Minister, who sits, Madam Speaker, to my left. You know, Madam Speaker, I brag to my other colleagues that I am the only minister with a world champion who sits beside me and gives me protection. She has been a tower of support, and I am really happy for her and happy that she is with me and she's committed and dedicated. And I thank the Prime Minister for appointing her, and I thank her for her dedication and her hard work. Madam Speaker, I want to also pause to thank the people of West Central St. Catherine, who unfortunately, because of the situation, they could not be here today. They are the ones who have caused me to be here, and this government to be here by extension. And they returned me to provide service to them with an increased majority of almost 5,000 votes. The challenges are there. COVID has been a distraction in many cases, but I want to say to them, I love them and will continue to represent their best interests. Madam Speaker, I also want to say thanks to the health team at the Ministry of Health and Wellness, but across the length and breadth of Jamaica. And I want to single out in particular the Permanent Secretary, Mr. Dunstan Bryan, and the Chief Medical Officer, Dr. Jacqueline Bisesa McKenzie. You know, it is very rare in my professional life, Madam Speaker, that I work so closely with individuals. And I tell you, over the last year to 13, 14 months, I've worked extremely close with those two individuals and their respective teams. I've benefited from their counsel, and sometimes I've had to do a little counseling myself. But in the end, we've worked things through. And I want to recognize them for their efforts, for their dedication, and for their commitment to this cause. I want to also use the opportunity, Madam Speaker, to say that never before, in my own estimation, and I thought about this last night as I looked over the presentation, has public health been in this position in this country, where it is the most current and topical issue in terms of policy, in terms of everyday life, in terms of the direction and the decisions that we make. And in a sense, we're in a unique position. There is no indifference or neutrality when you talk about public health. We conjure up and attract very extreme sentiments. So it's either we are praised and thanked for the work that we do, or we're vilified and criticized for the decisions that we make. In fairness and for the record, the government makes the decisions as it relates to policy, but clearly benefit from the advice of the public health team. And what I'll say for the record in this House is that at no time at all have we in our deliberations, even when they are contentious, ever taken a decision or recommended or given advice that runs contrary to what we believe is in the best interest of the Jamaicans. I want to also, Madam Speaker, say thank you to a small team. They know who they are, and they have been my counsel, and I've depended on them for advice, and I just want to say thanks to them. And finally, but not least, my family. You know, The last year has been very challenging as it relates to family. And, Madam Speaker, while we as public servants sign up for scrutiny, for criticisms, for even rumor mongering and gossip, our family members don't. And I want to just publicly say to them, thank them for their support, thank them for their love, and I will always be there to give them. Madam Speaker, COVID-19 remains a clear and present danger to our population and indeed to the world. This government will remain committed and sincere about calling the issues as we see them and taking decisions that are in the best interests of all the Jamaican people. Our mantra has been balancing lives and livelihood. The Honourable Prime Minister has said it several times. So we consider all issues and individuals when the government makes decisions. But let it be clear, we have never compromised on the protection of the lives of the Jamaican people. COVID-19 may have dominated our time and attention in the last year, but our public health system and healthcare workers stood up to the task while continuing to respond to other health challenges faced by the Jamaican people. In other words, we didn't spend the last year just dealing with COVID, because there are so many other things that we were doing prior to COVID, and those things had to continue. I give you a preliminary data on some of the things we have done, just to show the commitment that was required to do everything at the same time. Madam Speaker, we had 2.8, and I'm rounding the numbers, 2.8 million visits to public health facilities compared to 3.3 the year before, 2019 that is. We had 1.8 million visits to our health centers compared to 2 million 2019. We had 1 million visits to public hospitals compared to 1.2 the year before. And yes, there was a decrease, and I'll explain that decrease later on shortly. We also, Madam Speaker, had total surgical operations increased actually in 2020, 52,000 approximately, compared to 34,000 the year before. 145,000 admissions for care and assisted in delivery of 34,259 births. We provided public health, that is, Madam Speaker, some 289,000 diagnostic imaging services, including X-rays, CT scans, and MRIs. And we did almost 8 million lab tests during the last year. Madam Speaker, the team worked hard, not just on COVID, but on providing general response to the population. But we did have some reductions, and those reductions we tried to restructure and compensate for to ensure that the Jamaican people maintained full attention. So, for example, we used telemedicine for continued care of patients previously seen in the hospital, outpatient clinics, and health centers. Indeed, Madam Speaker, we would, the doctors that is, having prescribed a patient that had a chronic illness, instead of giving him a prescription for 1 month, we'd give them a prescription for 2 months. So there would be no need for them to revisit twice over a 2-month period, particularly with our older patients based on the doctor's advice. Some services were curtailed. For example, in the dental area, we used our dental staff to provide direct COVID response, 268 of those, and therefore, yes, we have had some backlog there. But overall, Madam Speaker, colleagues, our 2,452 doctors, 5,153 nurses and midwives, 1,471 paramedical and allied workers, and over 8,000 administrative and support staff represented an 18% increase in public health workers. This government increased the complement of public health workers in order to deal with the COVID response over the last year. We did more, though, Madam Speaker, because in 2019, September, having recognized the shortcomings within our hospital system for diagnostic services, we launched the Public-Private Partnership Enhancing Healthcare Services Delivery Project. During the last year, we used that project, Madam Speaker, to provide some 22,500 tests at no cost to those persons who were doing those tests. Previously, when a patient went to a public hospital and the MRI machine wasn't working or the CT scan, they were given a piece of paper and sent to go do it privately at their expense and then take back the results for the doctor to diagnose and to treat. This program said that you don't have to pay. We paid the private provider, and some 22,500 tests were done at a cost of 900 million Jamaican dollars. Madam Speaker, while the COVID-19 pandemic continues to be a major health threat to us all, we must also take time to see the opportunity that exists to reshape our current healthcare system, strengthen our resilience, and restructure our arrangements to build back stronger. Historically, Madam Speaker, we have seen where crises have forced countries and individuals to engage in alternative and innovative ways of doing things and to imagine and reimagine and construct a better future for themselves and for the collective. COVID-19 must also be seen as our opportunity to make healthcare stronger and more resilient for the people of Jamaica. You know, Madam Speaker, personally, I have learned from this experience that life is fragile, something we all must accept. We're here today, we're gone tomorrow. We've seen many persons go that route, and tomorrow could be us. However, we can improve our life chances through lifestyle changes and restructuring and structuring our society to enhance our health profile and reduce our vulnerabilities to health threats. I would like us to appreciate, even though it appears counterintuitive, because we have viewed COVID as a threat, and it has been only about the negatives. I would like us to examine a few of the positives that have flowed through, that have come out of the COVID experience so far, which hopefully will cause us to be hopeful for the future. For example, Madam Speaker, public health had a crisis management plan that provided the framework for managing this global pandemic long before the first case of COVID-19 came to Jamaica. It provided the basis for a more detailed and tailored plan to deal with this pandemic, which our team, led by the Permanent Secretary and the Chief Medical Officer, put in place. We took early decisions, and those decisions paid off. We learned from this pandemic and strengthened that plan for any future occurrence. Madam Speaker, that is a good thing. We are stronger based on the experience of COVID, and will ensure we have a plan in place to deal with any other future threat similar to this particular pandemic. Our surveillance capacity worked well and showed that whether it is a dengue outbreak or a global pandemic, the likes of COVID-19, we have the capacity to monitor and conclude on the issues to respond effectively. Surveillance, Madam Speaker, is the brain and nervous system of Jamaica's response to public health threat of the COVID-19 pandemic. It provides crucial ongoing data from a variety of sources such as hospitals, communities, and laboratories. Using our effective and well-trained team on the ground, we track the numbers, analyze the trends, and presented the data in a structured, understandable way for decision-making in response to the pandemic. Between 2020, Madam Speaker, and May 2021, the public health team, working with the Jamaican people, conducted over 95,527 contacts. This is the contact tracing, identifying people who are at risk or who had contracted COVID, tracking their movements, determining who they were in touch with, testing, 95,000 over a year. It took a lot of work at the community level to do that. Our national epidemiological surveillance system has effectively provided us with crucial information for us to quickly respond and to save lives. I want to say here that we in this House and the Jamaican people all should be proud to be associated with a team of dedicated experts led by our national epidemiologist, Dr. Webster Carr. From my perspective, they are second to none, and they are stronger for the COVID experience. That's a good thing, Madam Speaker, and something we should build on for the benefit of the Jamaican people. Our hospitals and their management teams of CEOs and SMOs, directors of nursing, supported by the Ministry of Health and agencies such as the National Health Fund, demonstrated that we can respond to an exponential threat. Between January 2020, Madam Speaker, and March 2020, when our first case was discovered, those very members in the public health system, the hospital management, had put in place 163 COVID beds by the March 23rd. March 10th was the first case. And currently, we have over 723 COVID designated beds, including our field hospitals that are prepared to deal with persons who need that kind of care. We have more than that. We have 26 HDU ICU beds, over 40 ventilators. Madam Speaker, the public health system is more resilient and stronger as a result of this experience. In fact, the public hospitals admitted over 7,700 COVID or suspected COVID cases in 2020, representing about 5% or so of admissions. Over 7,500 of that number were treated and sent home back to their families. That's an indication, Madam President, of, Madam Speaker, a 1.8% mortality rate with a global average of some 2.2%. Our track record, Madam Speaker, is better than the world's average in terms of treating patients. Tribute to our public health workers. We had over 2,000 primary care personnel across the island involved in contact tracing efforts in the communities, including medical officers of health, public health nurses, public health inspectors, contact investigators, and community health aides. They are better for the experience of COVID-19. As a result, as a country, we are better off, and we must now build on that experience. Madam Speaker, I want to speak briefly on communication. And I say so in what I'm about to say, say it with absolute humility, but I want it to almost be a teaching moment, particularly for those who have been critical of our communication strategy as we seek to confront this COVID response and keep the public informed. Madam Speaker, over the past year, a major point of learning has been the fact that if the interventions and programs related to health are to be successful, the state must have the trust of its citizens. This is even more important in a crisis. Madam Speaker, trust is the currency of any crisis. If the people don't trust you, they won't listen to you. Strategically, it has not been easy in this COVID response to maintain and sustain this trust, as we are constantly bombarded by conspiracy theories, misinformation, and other distractions from the core messaging of prevention and being safe. You know, people have chipped in the vaccine. COVID is a conspiracy theory. It's an attempt to, and I could go on, Madam Speaker. A major factor that cannot be denied is that public health has attempted to build that trust. As we look to breaking the back of this pandemic and building resilience within the health system, we cannot underestimate the need for investments in the building of trust. The fundamental to this end is the development and management of open, honest communication with the Jamaican people. Madam Speaker, as a ministry and as the minister, I can't guarantee that every news we give will be good news. Clearly, we call it as we see it, but it will always be honest and forthcoming because that is what builds trust. In this regard, Madam Speaker, our commitment is to constantly invest in the building of the trust capital through strengthening critical communication channels, strengthening our information points in traditional and non-traditional media, and reaching you directly within your communities and homes. Open and honest communication is the hallmark of good governance and is the linchpin of any successful health strategy going forward, Madam Speaker. So, You know, Madam Speaker, I know I'm accused of being the PR minister. I've seen it, I've heard it. Well, you know, I take that title as a badge of honor. As a badge of honor. And I'll say to those who have objections to it, somebody once said, let that sink in. I enjoy being the PR minister. Because in a crisis, if you people don't know, they won't know what to do. And what we'll do is create confusion. Madam Speaker, our future as individuals and as a country will be better as a result of the lessons learned from the COVID experience. And this must be our mantra. Time to share and reinforce the good things from the COVID-19 experience. Time to be hopeful and renew and build back stronger. This is what this government is all about, Madam Speaker. Now is not the time to be afraid or uncertain about our future. We are in good hands. We're in safe hands. Andrew Holness, as Prime Minister, with the Cabinet of Jamaica, and my colleagues on this side, with the support of my colleagues on that side, we can lead this country back and back stronger and overcome the COVID strength. And we know that Jamaicans want to hug up again. They want to get together again. And our mission is to provide an atmosphere and an environment that allows them to do that. And we want them to believe that we can. And that is why it's important to communicate and to let them know what's happening. Madam Speaker, members may recall that even before COVID-19, this government tabled a 10-year strategic plan in the year 2018 for the renewal and the rebuilding of public health in keeping with our Vision 2030 document and the United Nations Sustainable Development Goals. I announced that a year and a half or so ago. That is the IDB-sponsored project, which would lead to expansion in certain critical infrastructure. Today, I'm giving, Madam Speaker, as part of that hope for the future, an update on where we are as it relates to that project. Members will recall that the government committed a significant capital expenditure of between $205 million US and $236 million US over a 5-year period for infrastructure, hospital and health center build-out. I'm pleased to report, Madam Speaker, that under this program, which is the Health System Strengthening Program, 11 of 13 facilities have been designed and are being reviewed now for final approval to move to the next stage for building out. These include, Madam Speaker, the Spanish Town Hospital, the St. Anne's Bay Hospital, Maypen Hospital, and in addition, we have completed external upgrade designs for the University Hospital of the West Indies and also the Cornwall Regional and Western Children and Adolescent Hospital in Montego Bay, though that build-out will continue over time. Madam Speaker, let me just give you a synopsis. On the screen, there is a full list that involves several other entities, but let me give you a synopsis of some of the major ones. The Spanish Town Hospital. The Spanish Town Hospital, a Type B facility, has started to benefit from a $2.3 billion upgrade, and we have completed now the designs of the new-look Spanish Town Hospital. And that's how it's going to look, Madam Speaker. At the time of its establishment in 1952, it had a 220-bed capacity. The hospital now has 431 beds. However, the population expansion in and around St. Catherine and that community has caused significant overcrowding in that institution. With this upgrade, Madam Speaker, new services are going to be added to the Spanish Town Hospital, including urology, oncology, cardiology, gastroenterology, ophthalmology, and psychiatry will all now be offered in the new-look Spanish Town Hospital, Madam Speaker. And by the way, that's not just an artistic sketch. That's how it's going to look when we are completed. That was taken directly from the architects who are working, and we are well advanced. And at a future date, we will unveil all the plans and what it will mean for the people of St. Catherine. Madam Speaker, the St. Anne's Bay Hospital, a Type B facility, has started to benefit from a $550 $45 million upgrade, also in the design stage. The hospital was built in 1929 with an initial capacity of 15 beds. The hospital now has some 308 beds. Like Spanish Town, expansion of the area, greater demands on the system, not much change in the infrastructure. The new upgrade will include physical and functional reorganization of services, a new outpatient block, expansion of radiology, and a new intensive care unit. Madam Speaker, St. Anne and its environs are going to benefit from a new look and a better resourced St. Anne's Bay Hospital, and we will unveil the designs for that in short order. Then we go to the University Hospital of the West Indies, Madam Speaker. The University Hospital of the West Indies has started to benefit from a $4.9 billion upgrade of building and equipment, again, now in the design stage, and that's the actual design. That's not just an artistic sketch. Madam Speaker, a Type A hospital, the University Hospital, was established in 1948 at an initial bed capacity of 200, now increased to 554. The upgrade will include a new 6-story, 120 square feet medical facility, which will accommodate an additional 40 medical and surgical beds, improvements to the outpatient or ambulatory surgery, lecture rooms, conference rooms, and upgrading of the cardiology hybrid intervention surgery room and the neonatal intensive care and administrative department. Madam Speaker, the new University Hospital, Cabinet in fact just approved 3 weeks ago or so the resources to complete payment for the design, and once that is done, this is the external look. The ring road is going to be adjusted, the entrance to the facility is going to be adjusted, but the University Hospital, which is our primary tertiary level hospital for teaching and research, serving not just Jamaica but the Caribbean, is going to have a new look in the years to come to benefit the people of Jamaica and the Caribbean. That is building back stronger, Madam Speaker. Madam Speaker, Western Jamaica, in particular the Cornwall Regional Hospital, has been a source of many challenges related to the main hospital building. This has been a classic case of what happens when you don't maintain your infrastructure. And I'm not prepared to take responsibility on this side for that burden, as some would like us to believe. Because the truth is that hospital, that facility has suffered from chronic neglect over many, many years. And some of the indicators of collapse, and I've seen the documentation, took place when we were on that side and they were on this side. But having said that, not blaming anybody, the truth is, facts are facts. The facility has suffered from major neglect. And we have to fix it. Madam Speaker, let's be clear. Even as we fix the hospital, the services being offered have continued, and that is what is most important at this time to the citizens. Because this argument about repairing and no consideration for the fact that the doctors and nurses continue to serve the people of Western Jamaica is unfortunately doing a disservice to those doctors, nurses, and their support team. Let me give you a little statistics on Cornwall Regional over the last year to show that work is taking place in terms of service provision. 12,600 admissions, of which 7,500 were A&E admissions, performed over 8,000 emergency, elective, and outpatient department services. The hospital did over 300 inpatient operations, 1.3 million lab tests, 10,980 hemodialysis sessions, and over 8,000 chemotherapy procedures, and delivered over 3,000 babies over the last year. Madam Speaker, I want to thank the workers, the healthcare workers and their support staff who work at the Cornwall Regional Hospital, and I want to say to them that it will be bigger, better, and stronger in the next year to 2 years. We are now entering phase 2B of the project, which will include demolition and structural repairs to floors 1 to 6 and installation of roof on floors 3 to 6. We're also now making preparations, Madam Speaker, to go to the international market for a contractor for the third and final phase to totally rehabilitate and equip all 10 floors of the Cornwall Regional Hospital. Madam Speaker, when this process would have been complete, I'm saying we won't make the same mistake twice. Once we are providing the policy guidelines to that institution on public health. Cornwall will restore its pride as one of the finest Type A facilities in the region. The upgrade will include advanced and completely digitized diagnostic services in keeping with the current international health standards for infrastructure. At the end of the process, we will also have an effective building management system to allow for up-to-date and advanced maintenance services. And all major plants and equipment will be properly managed, Madam Speaker, and a new spatial structure will allow for better infection prevention and control. Cornwall Regional will come back, and it will come back stronger for the people of Western Jamaica. Madam Speaker, Western Jamaica will also benefit from the construction of the Western Children and Adolescent Hospital, thanks to the generosity of the Chinese government. And that is actually a final look of what that facility will be when it's completed. COVID-19 understandably created some delays, but I am happy to report that the Chinese construction team are now finalizing plans to be back in the country over the next 6 or so weeks, and will begin shortly after. The hospital has a 220-bed capacity, and adolescent hospital will be the only one of its kind in the Caribbean region. It will be the only hospital, Madam Speaker. Bustamante is up to 12 years old. Western Children and Adolescent will be up to 18 years old, and the only hospital in the Caribbean that will treat 12 to 18 adolescent population in a very specialized, focused environment. The hospital will boast pediatric intensive care and high dependency care units, and will have the first pediatric emergency department on the western side of the island. It will also cater for the pediatric population with specifically designated outpatient service, a dialysis unit, and lab services, and cater to the adolescent age, as said earlier. The complex will also, very importantly, this complex, generous gift by the Chinese, will also provide modern housing for healthcare workers who work in the hospital, a major incentive. Madam Speaker, we're building out this infrastructure, and these are only but a few. If you look in your printed copies, you will see a list of other infrastructure development, like a health center in Old Harbour, over $400 million, now in the design stage. In Portmore, in St. Anne, in Clarendon. Huh? Madam Speaker, a significant number of infrastructure that are slated under the IDB project. The Greater Portmore Health Centre, St. Jago Health Centre, Old Harbour Health Centre, Maypen, West and East, Brownstown Health Centre, St. Anne's Bay Health Centre, Ocho Rios Health Centre. Madam Speaker, the resources are in place, the designs are almost complete, and in the next year, or certainly during this period, you will see us breaking ground for the renewal of our infrastructure in public health. We are building back stronger, Madam Speaker. There is reason to be hopeful. But having built out all this infrastructure, Madam Speaker, we also have to ensure that the management systems within the infrastructure works and works well. And so I'm pleased to announce, again, under the leadership of Andrew Holness and this government, over the last 2 years, the government has been working on what is going to be the most significant investment in health information systems, $8.5 million in a digitized, integrated health information system, Madam Speaker. A multi-stakeholder National Health Information System Committee has been formed. And this is really what's going to happen. It's on the screen. Essentially, Madam Speaker, healthcare is going digital. Yeah. That's really what it is. You go to the doctor at a hospital, you came from a clinic, the doctor uploads your information. You don't have to wait 2 hours to go find the paper-based file. It will have your medical history, which medication you are taking, what were your symptoms, how are you being treated, what are you allergic to, if you have x-rays, what those x-rays showed, and the doctor will be able to prescribe, having assessed you in a much more efficient way. It's about reduction of transaction time and cost. for the benefit of the Jamaican people, and that is what health information systems will do. Madam Speaker, we're advanced with this, in that we're just about to sign a contract through the government procurement process with a provider to install the hardware, the networking of the institutions. We're starting with 3 hospitals and 9 or 12 health centers. We're linking the hospitals to the health centers within that particular area. The contract has been signed, will be announced soon, for the provider to put the hardware and the networking in place. And then we will go to market after that for the software to be placed for the hardware to give the support in order for the health information system to be put in place. Madam Speaker, there's reason to be hopeful about the future, because if we have that system in place, we can deal with the threats like COVID and other threats that we will encounter going forward. Madam Speaker, we are also going to do other things. Telehealth and telemedicine is our next big thrust. We are now in the process of identifying a vendor to gradually roll out home care and telemedicine. The ministry has also successfully implemented a tele-eco program to train healthcare professionals on best practices in chronic care. We have already trained over 1,000 healthcare workers in this area, Madam Speaker. We are preparing our healthcare workers for the next generation and for the future. We should be hopeful. Madam Speaker, perhaps the most profound lesson from the COVID-19 experience is the extent to which persons die from the virus because they were already sick. I want to repeat that because I think it needs to get across in the psychic of the Jamaican people. The persons who died from COVID, the statistics show, are persons who were already sick. I want you to look at the screen, Madam Speaker, because it's so important for us as leaders, as legislators, to lead this narrative. 1 in 3 Jamaicans have high blood pressure or hypertension. By the way, 40% of them don't know that they have it until it throws them down, until they get a stroke. They don't know that they have high blood pressure. 1 in 10 diabetic. 3 out of 20 or 15% chronic kidney disease. Many don't know it because they don't know their health status. They don't get the checkup as we know it as. They don't go to the doctor to do the regular routine checks. Deaths, Madam Speaker, from the COVID experience demonstrated and reinforced again that deaths were high among those persons who were already suffering from lifestyle diseases, hypertension, kidney failure, heart disease, cancers, type 2 diabetes. Unfortunately, there's just too much of it in the population. Yeah. Too many of us. And I say us because all of us are suffering from some ailment because of how we live and how we interact within our environment. Madam Speaker, we have spent much time dealing with COVID-19 and the pandemic, but prior to this, not enough time dealing with the epidemic of non-communicable or lifestyle diseases. That needs to be a lesson from the COVID experience, and that needs to change, and we need to lead that charge. It is significant. Our bodies and what we do with it and what we put in it over the years had a significant impact on how we responded to the COVID-19 virus. The foods we eat, our physical activity program, rest and relaxation, pollutants in the environment are all contributors to our personal health profile. Madam Speaker, the term knowing your health status may have been a cliche in the past, but COVID-19 has taught us that it cannot be anymore. We must take better care of ourselves as individuals. And we say in public health, we need to be our own hero. We need to start thinking about ourselves, because if we do collectively, we will start thinking about each other. In that regard, Madam Speaker, I want to say something about consumer choice and the right to know. Our democracy promotes freedom of choice and indeed competition among lifestyle options within a regulatory framework that protects those rights in a transparent manner. The right That right should be enhanced by ensuring that our citizens have information to help them make informed decisions about the choices they make. I think we have a duty to ensure that our citizens are at least aware as they make the decisions around lifestyle. When consumers make choices about the foods they eat, they should do so knowing the risks and/or the benefits in consuming those foods, particularly if they are paying for it.
Madam Speaker, I now ask that the standing orders be suspended to enable the minister to continue his speech to its conclusion, notwithstanding the time limit on speeches. The question before the House is that the standing orders be suspended to allow the minister to complete his presentation. Those in favor? Aye. Those against? The ayes have it. Minister.
Thank you very much, Madam Speaker, and I appreciate the same leniency that you have offered to my colleagues. I'm not pointing any fingers, Madam Speaker. I'm not pointing any fingers. But we'll wrap up soon. Madam Speaker, I was speaking about lifestyle and in the post-COVID era, and the right of consumers to know what's in their food as part of their fundamental right to good health. And I'm saying it must be highlighted if we accept that lifestyle is our primary risk. You know, let me draw a parallel here, Madam Speaker, to highlight the impact of lifestyle diseases. COVID-19 has so far claimed the lives of approximately 3.3 million people globally, just over 800 people here. On average, however, each year, over 40 million people die worldwide prematurely, meaning before the age of 70, from lifestyle diseases. And indeed, there's another chart that's supposed to be in your book. I was hoping it would go up on the screen, showing the breakout of the COVID-19 deaths in our country. I can remember the key statistic, which is that 74% of the deaths, okay, there it is. 3 out of 4 deaths of all the deaths in Jamaica from COVID-19 are 60 years and over. 5 out of 10, or 50%, have cardiovascular disease, which hasten their demise, and the rest is there. 9 out of 25, or 36%, diabetes, 1 out of 15, 10% chronic kidney disease, 1 out of 20 neurological impairment. The fact is the overwhelming majority of the deaths were caused by that lifestyle disease. And in the world, lifestyle diseases claim far more lives than COVID. Premature deaths, people before they get to 70. And the main driver, Madam Speaker and colleagues, has been unhealthy diets. Diets that are high in sugars, in salts, and in fats. Madam Speaker, as a government, we have an obligation to support initiatives that give our people the best chance of correcting this unhealthy trend. Indeed, we have committed to it. We may forget, but we have committed to it. We are signatories to the United Nations International Covenant on Economic, Social, and Cultural Rights, which recognizes the right of everyone to the highest standards of health, where there are other conventions that make it our duty to promote good health for our people, including Article 24 of the Convention on the Rights of the Child, which recognizes that all children are entitled to guaranteed rights to healthy food and adequate nutrition, and that the child and their parents should have access to nutritional information about their foods. Madam Speaker, the Jamaica Standard Act requires, and I'm quoting, every label on any container of processed food offered for sale must state all its ingredients. But it's not just about stating the ingredients, because I tell you, sometimes when you try to read what's on some of these brands, you have to have a chemistry degree to understand what it means. So the convention doesn't just call for stating it. The convention requires it to be understandable to the average man. And I tell you, we would betray our duty if we don't ensure that that is the case, both for ourselves personally and our families, but also importantly for the country. It is with this in mind, Madam Speaker, that the government is moving to establish baseline information on ingredients in processed foods and will seek to use this information to provide greater consumer awareness as part of encouraging health-seeking behavior within our population. We have commissioned studies on salts, sugars, and trans fats in our foods. And it's important, and I think it's a duty on our part. Madam Speaker, I want to use the example of trans fats to explain why information is important for consumer choice. And remember, no, we're not forcing anybody to do anything, but we at least have a responsibility so people will know. Trans fats are produced when vegetable oils are chemically altered by adding hydrogen to harden the product and improve the shelf life, stability, and taste. Trans fat increases low-density lipoprotein, which is the bad cholesterol, and reduces the beneficial cholesterol, which is the lipoprotein high density. These affects negatively on cardiovascular functions. In fact, if you consume enough trans fats, your chances of dying will increase by 28% according to the clinical studies. And let me break it down. Enough trans fats will clog your heart and likely you end up with a heart attack. I'm not here to scare anybody, but I'm saying it. That's what the studies show. That's what the data shows. Coronary heart disease is a leading cause of death in Jamaica, Madam Speaker. This is through strokes and as well as strokes and diabetes. Now, the WHO recommends the elimination of industrial produced trans fats from the food supply and replacing them with healthy alternatives. And I tell you, we may not recall at this point, but Jamaica was one of the first countries in the Caribbean to join the Pan American Health Organization initiative to eliminate industrially produced trans fatty acids by the year 2025. So we have actually signed on to that. Last year, Madam Speaker, we commissioned a study in conjunction with the University of Technology to look at trans fats in our foods. And what we came up with is that of all the foods, and I have a list of the foods, but we just put the categories. So you have baked goods, breakfast cereal, beverage, chocolate mix, canned foods, and so on. I just put the categories, even though we have the brands, which we won't speak to. Let me give you the summary. The summary is that of all the foods that we have tested, and it was about just under 300 different brands, 39% contain trans fats, and 61% did not. It would be nice to know whether the ones that I purchase have trans fats or not, and I believe we'll all agree to that. We did the same thing with sodium, Madam Speaker, or salt, using the WHO standards of recommended salt intake, and it also showed some meeting the recommendation, others not. Madam Speaker, the action item here is that in the coming year, we will continue our drive to educate consumers on the dangers of unhealthy foods and push for lower levels of salts, sugars, and fats in our diets, and over time, in keeping with our decision we took many years ago, the elimination of trans fats in our foods. We'll also be pushing for labeling requirements that are clear and easy to understand, including front-of-package labeling, in the interest of protecting consumers' right to know and for good health. Madam Speaker, earlier this week, we launched an initiative that was announced 2 years ago, a Better For You menu initiative, in conjunction with a number of restaurant chains in Jamaica. And what we have done, Madam Speaker, essentially is not unique to Jamaica. It's in other countries, but we created our own symbol. We did some focus groups some years ago under the Jamaica Moves banner, where we spoke to consumers and we recognized that people were eating less at home, changing lifestyle. You ate on the run, you ate on the road. And some of the favorite restaurants that are stated there are visited and you purchase your meal. Well, we brought them together and we had a discussion with them, Madam Speaker. And we basically said to them, why don't you work with us to design a symbol that you place on your menu board where you develop healthier options and you give the consumer the choice. If they have to go to chain X or restaurant Y, these are the options you have, and that symbol, the better for you with the tick, is an indication that this represents the healthier option on that menu. Madam Speaker, I'm happy to announce that those restaurants agreed to come on board, and yes, there are perceptions around those brands, one way or the other. There are loyalties among those brands, one way or the other. Our issue is, let us start to nudge the consumer into start thinking about healthier options. Yeah. This doesn't solve all the problems, and it's not intended to solve all the problems, but it at least is a start, and that's what we want as we build greater awareness. Well, over time, the intention is to expand that to traditional restaurants. So when you get your menu in hand, you can see the symbol on that menu sheet, and you can see what on that menu sheet is better for you compared to the others. Madam Speaker, it's important, and we are nudging and encouraging consumers to seek out healthy options. We're also saying to manufacturers and suppliers, let's work together to give consumers healthier options. In other words, Madam Speaker, it is good business to promote healthy living. It is great living to eat healthy. Good health begins with better choices, and that's what the Better For You menu is all about. And I want to commend those who have been part of the coordination and the development of that. Madam Speaker, working my way down now, I want to speak quickly on physical activity. Remember now, we're talking about curative measures, hospitals. We're talking now about prevention measures, which prevention is always better than cure. Madam Speaker, while nutrition is important to a healthy body, physical activity adds the strength and resilience we need to preserve quality of life. Physical activity can reduce the risk of major illness, including stroke, type 2 diabetes, heart disease, and cancer by up to 50%. Exercise can also lower the risk of early death by up to 30%. These are what the studies have shown. It's also very good for your mental health. Madam Speaker, in 2017, the Jamaica Moves was launched as our primary physical activity and, to a lesser extent, nutrition branded program. You know, Madam Speaker, we launched the Jamaica Moves in 2017, and I'm proud to say, working with the team, that it has received endorsement from CARICOM, the United Nations, the Pan American Health Organization, and the World Health Organization. This government and the Ministry of Health and Wellness and the team out of the Jamaica Moves provided advice and support to establish Caribbean Moves, Barbados Moves, St. Kitts and Nevis Moves, Trinidad and Tobago Moves, all modeled off the Jamaica Moves idea. And those are the logos up there, Madam Speaker. And I want to say, Madam Speaker, that the value of the Jamaica Moves is not just in the physical activity program. I'm coming to that, because I knew you were going to ask. I'm coming to that. The value of the Jamaica Moves is not just in the physical activity program, but importantly, the concept of Jamaica Moves is to use culture and behavioral sciences to influence health-seeking behavior. In other words, Madam Speaker, the challenges that we face in Jamaica with lifestyle issues is not going to be solved through clinical science. It's not going to be solved through the prescription pad or the hospital bed or the emergency room. It has to be solved through behavioral sciences. It has to be solved through health-seeking behavior, getting persons to adjust lifestyle. And that's what the Jamaica Moves program did. That's fundamentally what it did. The success of the program also came from partnership, especially public-private partnership. And I would like to take this opportunity to thank, Madam Speaker, those who have been a critical part of the creation of the brand and what it represents against lifestyle disease. And let me give you some of the statistics. Over the 2019 to 2020 period, Jamaica Moves engaged with over 150 workplaces, promoted healthy lifestyle, hosted focus groups across the island, managed social media pages with daily original content, which saw 53% growth in followers, over 12 million impressions. What an impression is by social media standard, people see it, they look at it. And 183,000 engagements, having seen it and been exposed to it, 183,000 persons responded. So it has had an impact. I would like to announce today that the Jamaica Moves brand has been transferred and is now fully the property of the Ministry of Health and Wellness. Madam Speaker, I want to say that the brand was created, and I want to place on record because I appreciate all the distractions and, frankly speaking, the right to public scrutiny. Don't misread my intentions. We are all subject to public scrutiny. But I want to place on record that the Jamaica Moves brand was transferred from the company Market Me, the company that created the brand, coordinated its execution, including private sector support, and the company that worked up to this point with the Ministry of Health and Wellness, the NGO community, and private players to make this brand not just a Jamaican initiative, a regional initiative. And I want to place on record my thanks to Market Me and the other stakeholder partners for their efforts in building out this brand. I also want to say that the brand will continue to be the flagship brand of the Ministry of Health and Wellness physical activity program, as it is now fully lodged in the Ministry of Health and Wellness. I would also like to announce today that we are launching another program, a pilot software application program called Get Moving with Jamaica Moves. This is an app that you download on your phone. I want you to take a look at that because we have high hopes for that. This is around self-monitoring, Madam Speaker. You don't need to go to the doctor. The doctor is on your phone, okay? The app is part of our initiative to promote self-monitoring of personal health status by allowing individuals to check their blood pressure, blood glucose, weight, and stomach mass. Stomach mass, right? Stomach mass, or your gut mass. And Madam Speaker, input the data on the app on your phone to receive, very importantly, to receive from your phone and the app health tips about your current health status. And Madam Speaker, I'm winding down, and I thank you again for I have a goodie bag here for every parliamentarian. Remember, ask me what's inside. Well, you're going to get a high-tech digital scale to stand on every morning. And if you want to weigh a little less, don't go at it when you have on your clothes. Wait just before you go into the bathroom. You're going to get a little home kit that allows you to check your blood pressure right beside your bed. Every morning you get up, you just, and it's all digital. So you know whether your blood pressure too high or too low, or just about right. And how can I forget measuring? Because, Madam Speaker, Speaker, the most significant indicator, hold on, this is very important, the most significant indicator of obesity, which is the primary cause of those lifestyle diseases, is right here. And I'm not referring to it when it is otherwise engaged. I'm referring to it under normal circumstances. You need to measure that up. We also have information on your physical activity program. We're throwing a little skipping rope just in case you want to and we're gonna add a home kit machine that checks your blood glucose level. So you prick your finger and you'll know whether or not you're prone diabetic. You want a bicycle? No, we can't afford that. You're gonna have to buy your own bicycle. But Madam Speaker, in seriousness, what we're trying to do and what I'm encouraging my colleagues to do is to let us become the agents of change in terms of lifestyle. Let's take the pressure off the system and off ourselves and off our families. You know, sometimes people say that, you know, them see me all over the place running on the road like I'm a madman, right? All right, listen. My best time in the morning is 5 o'clock. I make the time. And if it's walk, if it's run, if it's jog, all I'm saying is it's the best medicine that you can take in your own interest, Madam Speaker. So this program is about self-monitoring. And what the app will do, the app, once you put the numbers in the app is going to say to you, you are a little off, you need to go see a doctor if your blood pressure is too high, you are diabetic or pre-diabetic, the app is a doctor on call right on your phone. Now I was hoping to launch it today, but we had a little glitch. And so you will get this package, but we will launch it in another month or so once we work that glitch out. And that is Jamaica Moves on the go in your home. Madam Speaker, in closing, I want to mention one final matter, and that's the issue of health financing. Madam Speaker, COVID-19 has not only taught us that we cannot take our health for granted, but also how important health financing is to building, sustaining a resilient health ecosystem. It is time we discussed and agreed on how to secure health financing in a sustainable way. You know, the World Health Organization recommends, Madam Speaker, that at least 6% of GDP should be spent on public health. In this country, we spend about 4%. And I understand why. I'm not here suggesting that we should deprive other people, but ideally, that's where we ought to go. And we have improved, by the way, under this administration, health has gotten more of the budgetary pie, and certainly during the COVID period, and I want to thank the Prime Minister, the Cabinet, for recognizing and in their wisdom giving that support. But in a sustainable way, we need to get to that 6%. This is important to ensure progress towards universal coverage and healthcare systems capable of looking after the healthcare needs of our population without causing financial hardships or significant out-of-pocket payments. Madam Speaker, this country, and this is very important, must use the COVID-19 experience to come to terms by engaging in a frank debate and discussion around healthcare financing. We needed to do it long ago. We needed to do it long ago. I mean, I tell you, even as a parliamentarian, you know, we give of ourselves, and one day we need support, and it is challenging. Put it that way. I put it no stronger than that. But that applies throughout the country. So we need an all-encompassing review of the healthcare infrastructure. So we need to engage in that frank debate around healthcare financing. We can't sweep it under the carpet under the guise that it's too expensive. Indeed, it is too expensive not to have that conversation. The COVID-19 experience, and before that, the dengue outbreak in 2019, and the ongoing NCD epidemic and its economic and social impact on premature death, absenteeism from work, low productivity, revealed to us that aside from the personal pain and suffering from losing a loved one, poor health is just bad for national growth and for development. People who are sick can't work. They can't work, and they certainly are not going to be productive. Whether we want to call it health insurance, and we did table a green paper for discussion, didn't go very far because COVID intervened, we need to put it back on the table. Or whether we want to just call it health provisioning. Whatever it is, it must be addressed, Madam Speaker. And so my own action plan to myself and my team is that in the next year, we're going to find a way to raise the temperature, the discussion around how we finance healthcare going forward in the future. Madam Speaker, COVID-19 has been the most significant health crisis in the world since the Spanish flu over 100 years ago. We should never allow such a devastating crisis to, in a sense, go to waste. We should never allow such a devastating crisis not to teach us lessons. As we work towards recovery and to building back stronger, we need to assess, we need to work together on both sides of the aisle, and frankly speaking, we need to ask the good Lord to give us guidance so that we provide the leadership at all levels. In the coming months, we are going to have to embark on the largest mobilization program as it relates to vaccines. Now, I haven't gone into vaccines and so on because we talk about it every week. I have a COVID press brief with my team every week. But strategically, from a policy perspective, we are going to get out of this if we get the country behind us. And I know where my Prime Minister is because he has called for that several times. I'm saying to my opposite and the colleagues on this side, this country, if it is to pull through the COVID pandemic and move forward to provide the opportunities for the people, we're going to have to work together around this vaccine thing. We're going to have to get every Jamaican who is cynical, every conspiracy theorist who's not sure what they're talking about, but they're talking anyway, to understand and appreciate that this is the only way forward. The government is very hopeful that we will have vaccines. There are some contracts signed, but the truth is the world has a challenge as it relates to production, and so it may be over the next few months we will see a trickle and then we see a significant number. The plan is to prepare to do what we did with the last blitz we had, the first blitz actually, and to do more. And I'm calling on every member of parliament and elected official and indeed every leader in this country, private sector, public sector, to come together around ensuring that we mobilize the country. I want to thank all who have been a part of this process. I want to mention the National Health Fund, Mr. Mitchell, who is the chairman, Everton Anderson, the CEO, and the team, the private sector groups, the churches, all of us have to ensure that we redouble our efforts. I think we can do it, Madam Speaker. I think we have it in us. And I think the fact that we have survived 13, going 14 months, and substantially did better than a lot of other places in the world, we will survive the next number of months, and we will build back stronger for the benefit of the people.
Presentation or something.